Okay, I think. Good morning. Good morning. Good morning. Thank you for joining us this morning as we continue with our Health and Wellness Festival. We are so excited to have Dr. Jimmy Smith with us. He is our administrator for the Macon Bibb County Department of Health. And we're in the room here at the Macon campus in the Math Auditorium, and we are ready to hear how we can survive and thrive and survive as we're on this health and wellness journey. Dr. Smith is getting us all situated and prepared for this time that we're going to have. One of the things that I so love about Dr. Smith is that anytime we ask him to come out to share with us relevant information and resources that we need, he's always available. Not only that, he serves on our foundation Board of Trustees. And so can we just put our hands together and just thank Dr. Jimmy Smith for his time today. I am going to turn this over to him. It looks like he's got some things going on, and we're excited about it. So let me turn this over to him.
Good morning. Ooh, that's loud. Okay. Good morning. Certainly glad to be here today. And what I'd like to do as part of this wellness activity is make this interactive. So no slides, no PowerPoints. I won't say there won't be a quiz because I do teach on the side too. But do want to talk about health and wellness, but I want to make it real for you. So thank you to our 4 voluntold folks that are up on the stage. And the way I'd like to have this conversation about health, we're going to talk about health in Middle Georgia. We're going to talk about health overall throughout the United States. We're going to also put in pieces that talk about social determinants of health, those things that don't have a clinical name, but they impact your health. So things like where you live, what your education is, how much you understand, health literacy, income, those types of things. And we're going to do that by playing a quick game. And our volunteers up here are all going to participate, but you also have to participate. So part of this, is anybody familiar with the game Survivor? Anybody ever seen it? So in Survivor, it's a game that actually, we have it as like a reality TV show, but it didn't start in the US, it started over in the UK and it was brought here. So in that, you have a group of folks that are put in some area, they're put through all of these they're put through these scenarios, and then they have to make decisions about who's going to be able to stay on the island, who's going to be able to go. That makes sense? Here is our island. And on this island is Middle Georgia, Macon Bibb County, but the island, and then what you do is when someone has to go, the other folks in the community vote them off of the island, right? So in here, they're going to tell you little bits about themselves using the scenarios I've given them, and then based on that, I'm going to ask you questions. You can ask them or ask me a few questions, and then we're going to have to decide who comes off of this island. But the island they're coming off of is life. And it's going to be based on things that they tell you about their health and their lifestyle. So first person, if I'm not mistaken, they're really going to be acting today because they have all of the male scenarios. So usually I have male and female up here, but we're going to do all male first, and then we're going to switch it real quick and do females. So if you would go first and tell just the first 2 lines about yourself.
I'm an assistant professor here at Middle Georgia State University, and my income is $75,000.
I hope I got that right on the HR side, but I was just putting in scenarios.
So I work at the Robins Air Force Base as a civilian, and I make $60,000 a year.
And the other thing, please tell them, I forgot, what's in the bold? Because I think I didn't say to do that on yours too.
So I'm male and I'm age of 56.
All right, African American or Caucasian?
I'm Caucasian.
We'll get it. So I'm a white male, age 32, work at the Air Force Base as a civilian, and make $60,000 a year.
I am an African American male, age 73. I am a retired principal from Bibb County Public School System.
Hello, I'm an African American male, age 32. I work for Macon Bibb County Public Works.
And your income?
My income is a meager $40,000 a year.
All right. Now, why do you have to add in meager? That was not on my script here. But I could also look at your faces when they were saying the salaries, and they were like, what, assistant professor makes 70? What is that? And then, but the civilian that was, what, 32 or so, made 60? And then he got to his, and he said he made a meager 40. What's the average per capita income in Macon Bibb County? What's the average income for a family in Macon Bibb County? It's about $45,000. What's the average income in Houston County per family? About 64. It's almost a difference of $24,000. Would $24,000 make a difference in your life? Might as well throw up both hands on mine. Income makes a difference. Income is one of those things that affects your health, but when you go to the doctor's office, you may go in because, hey, I think my blood pressure is high. I think my sugar or glucose level is a little high. No one goes in and says my income is low. That's not one of those clinical classifications that you have, but it certainly impacts your day-to-day life and on your health. Why do you think I had them tell you what their race was? It makes a difference, but why does it make a difference? Say it a little louder. Males may still make more than females. Men typically don't go to the doctor. So there's some other things that they have on their list. They just haven't told you about themselves yet, and a little more about them. But just based on the fact that we have all males up here, so we have 2 Caucasian males, 2 African American males. They range in age from like 32 up to about 70 something. If you had to say, okay, just with that little bit I know about you, and I hate to say it this way, who would die first? You said the 70-year-old? All right, so okay, so the 70-year-old is making more money. So the 73-year-old male, he's educated, principal from the Bibb County Public School System, retirement about $70,000 a year. That's the first person to go? All right, somebody said he had benefits. Does that make a difference? So insurance really makes a difference? You sure? It should make a difference. So, if you use it. Oh, that's a big one. So HR is in the back of the room like, yeah, we pay all these benefits and nobody's going to use them. So insurance makes a difference. So a lot of times we talk about folks going to, say, emergency rooms or urgent cares that even have insurance. Now, if it's an emergency, you absolutely should go there. But how many folks do we know have insurance and don't do their annual visit, don't do their preventive screenings? If you had to start naming off preventive screenings and say, okay, based on my age, I should have this and this and this, but then you go look at your work calendar, none of that is on there, is it? When you go look at your life calendar, your family calendar, none of that is on there. Unless you're probably taking care of a parent, an older family member, or children. We make sure they go get theirs. But then what happens to us? So then the caregiver is the one that begins to get ill. Let me ask a few questions. Based on just race alone, I think the 2 Caucasians on this side, 2 African American on this side. If you had to vote somebody off, would it be on this side or would it be on this side? Why? All right, but just based on race, they're not going to go? All right, could be based on, but let's just do it. Let's just look solely at race right now. Could be less trusting, so that certainly is a determinant of health. But what is race? Many of our illnesses are indicators of our biology. Your glucose level is too high, so you feel a certain way. Your blood pressure is too high, hypertension, so you feel a certain way. Race is a social descriptor. So why should a social descriptor determine who lives longer than anybody else? But it unfortunately, it is very true. It is very true. That's why we have what we call health disparities, which are differences in health outcomes between different racial and ethnic groups, regardless of their income. Certainly income attributes to it, but regardless of that, we have health disparities. But then we also have what we call health equity, which is where we try to achieve the highest level of health for all people, regardless. And you can put regardless, ... And anything that's in there, we try to address that. So it doesn't matter if you make 30,000 or if you make 90,000. You should be able to attain the highest level of health for all. But you are correct. If I had to choose in here, and we're going to hit life expectancy real quick, who up here would you vote off the island? And you said African American first. There's also cultural distrust of the healthcare system. And that doesn't matter whether it's at the nursing level, at the physician level, the PA level. Those exist, and those many times are historical. There are recent articles in the last 5, 6 years that even say if you have a physician that is of from the same race and culture as you, statistically, you can show a better health outcome. Now, was every physician in the country asked? No. It's a representative sample, and they're trying to translate that to all, which I don't know that it translates to all, but there is some truth to that. So there's some things that as a patient, you have a responsibility to do too with your doctor when you go in. So, and I'll just mention one now, we'll get to a lot in a few, but one is if you go in your doctor's office, your healthcare provider's office, and they do not touch you, first of all, let me go back up. They do not greet you by name. Find a new physician. Let's start with that. They come in, they start talking, hey, what you here for today? And they start going into that, and they've never called you by name. Find somebody else. Because first, they need to recognize you. 2, if you go in a physician's office and you are not touched, I implore you to find a new physician. Even if that touch is only a handshake or a hug, find a new physician if that physician does not touch you. Because what are we supposed to be in the business of? I promise you, a physician, the best physicians we have, do more with these than any machine ever will. Because your body will tell stuff if you allow it to tell you, and you have to do that through your senses, your sight, your hearing, and your touch. Those we have to do. So you're right, in terms of who would get voted off first. What I'm going to ask to do, I'm going to start on this end this time. Start at the top and read the whole scenario for you.
I do have a loud mouth too. African American male, age 32, works for Macon Bibb County Public Works. Income $40,000, single and no children. Lives in Pleasant Hill community, that's in Bibb County. Great. Health conditions, uses tobacco since age 16, 1 pack a day. Has health insurance, but no annual doctor visits. Uses urgent care when needed.
All right. Did anybody just think of a family member that fits that? About that age, has a job, got insurance, won't use it. But when we said he lived in Pleasant Hill, some folks were like, ooh, what's wrong with Pleasant Hill? Or there is something wrong with Pleasant Hill, let me say it that way. Anybody know where Pleasant Hill Community is? So Pleasant Hill Community is about a half a mile from the health department. It is the home, where the home place is for, anybody know who Sergeant Rodney M. Maxwell Davis is? He's the only Congressional Medal of Honor winner from Macon. So happens to be my wife's uncle. He was born in Pleasant Hill. Got the Congressional Medal of Honor because of the act he did in Vietnam of getting pinned down in a foxhole with about 5 other guys. I'm 6'3". I'm told he was about 6'8". He had really long arms, and as they threw grenades in, he would grab them and throw them back out. When they threw in about 6, he couldn't get them all out, so he scooped them all up and laid on them. As his body flew out of the foxhole, everybody stopped firing because they thought it was just him. We've actually met one of the guys that was in the foxhole with him that survived because he did that. That's why he was given the Congressional Medal of Honor. He's from Pleasant Hill. Anyone know who Jefferson Long is? Jefferson Long was elected to the U.S. Congress after emancipation and was only the second African American to be elected. Now, he only lasted about 10 months before they ran him out of there. But he was from Pleasant Hill. There's another gentleman, I'm going to blank on his name, who was the first African American college president, not of an HBCU. He was from Pleasant Hill. There are lots and lots of great folks that have come out of that community. When the Negro Baseball League had their first World Series, the first baseman for the Kansas City Monarchs was a gentleman that was born in Pleasant Hill. But that community that sits a half a mile from the health department has a life expectancy, average life expectancy of 64 years old. It is the one community in our county that has the lowest life expectancy in this county. 64. What's the average life expectancy for someone in the U.S.? We use 75. Average life expectancy of someone in Georgia is 73. So before I run these three, let me give you those real quick. Average life expectancy in the U.S. is 75. But the average life expectancy when you disaggregate or break down the data, because remember, average means there's folks above and below, the group with the longest life expectancy in the U.S. are Caucasian women, around 81, 82. And I may be cutting the years a year or two because the numbers have just changed. But let me say 81, 82. African American women, 76. Caucasian men, about 72, 73. At this point, y'all ought to be upset because I hadn't gotten to me yet. Y'all can get upset. I'd like to be around here for a minute. It just moved for African American males from 69 to 70. Now, if you start working at 18 and you decide to retire at 65 and you can get Social Security at 65, that means on average, someone that looks like me is going to draw Social Security for how many years? 5 years. But I've been working since I was 18. Is that fair? Should I get my Social Security early? I think so. Now, which candidate you think going to put that out there as a policy statement? Nobody. I don't care if you're Republican or Democrat, independent, Tea Party, nobody's going to put that out there. But when you know that, and we know that through public health practice and statistics, it makes a difference in how we approach communities. What was yours?
I am an African American male, 73 years old. I am a retired principal from the Bibb County Public School System. I make $70,000 a year. I am widowed for 4 years. My wife died from breast cancer at the age of 65. I have no children. I live in a community off of Sherling Drive in Bibb County. The health conditions that I have are high blood pressure, elevated PSA, and I am diabetic. I do go to my annual visits with my doctor.
All right. 73, you might say that's on borrowed time, wouldn't you? Retired Bibb County school principal, you think they ever got stressed? Does stress make a difference in lifestyle? It does. And that's one that none of us are going to escape. No matter what your job, you're going to have stress. You may have different levels of stress, different risk factors, causes for the stress, but we're all going to have stress. It also said he lost his wife about 4 years ago to breast cancer. Is that a stressor? Also mentioned he had no children. Who's watching out for this guy? So because he lost his wife 4 years ago, he's 73, he makes $70,000 in his retirement, in relatively good health, what other stressor does he have? I heard loneliness, what else? Yeah, but I'm not talking about the health stuff, the life stuff. So some people said loneliness. I guarantee you, if he may not be lonely. Because if you take a male, older, with a decent income, and I'm saying this just because I've seen it every day, and my wife does family practice, and she talks to the families, talks to the grown adult kids about their parents when a parent passes, particularly if the mom passes. I guarantee you he got his phone ringing, and he got folks stopping by the house. I just wanted to make sure you had something to eat today. You all right? Did you need to get to the store? Didn't see you at church on Sunday. Everything good? I guarantee you that man got some stress. Promise you he got some stress. I'm not joking. My wife does that. She would call in the adult kids, and it's worse if it's a pastor. Don't let the pastor's wife pass. Yes, ma'am. Don't let the pastor's wife pass. Guarantee you there'll be some new hats and new dresses in that church on the next Sunday. Somebody, because he need to be taken care of. That's the Lord's servant. He didn't call you to serve him, and vice versa. But, so for those that have parents where one parent may be deceased, watch out for your folks, because you don't know who's calling or who's stopping by the house to try to be helpful. And there's some folks you got to run away from your, yes, it works for both. Works for both. What's yours?
All right. White male, age 32, works at the Air Force, Robins Air Force Base, is a civilian, income of $60,000 a year, married with 2 children, lives in Roberta, Georgia, Crawford County. Health conditions: using tobacco since the age of 16, 1 pack a day. Has health insurance, but no annual doctor visits. Uses urgent care when needed.
All right. Civilian working at the base. We live in Middle Georgia, the base being one of the largest economic engines in our community. Is that unrealistic for someone 32 to be making $60,000 out at the base with no college degree? It's very realistic. Guess where a lot of them folk come from? No, right here. Y'all do a ton of work. And every time you have a career fair, I guarantee you the base is up here. And they're grabbing y'all folks, which is a good thing, because you're preparing them to go and do that kind of work. And they can make great incomes while they're there. 32, couple of kids, smokes a pack a day. But I put in there lives in Roberta. Why is in Crawford County? Anybody else live in Roberta? Anybody know why that would be significant? They don't have many doctor's offices. There's no hospital. There's one doc in Crawford. I think change that. I think there's 2 doctors in all of Crawford County. But Dr. Gatton, Freddie Gatton, probably sees 98% of those folks. Roberta's a county of about 12,000 people. I've been out there. I've gone around the county 4 or 5 times. I can't find 12,000, but they say the population 12,000. But the reason I mentioned Roberta is, remember we talked about those social determinants of health? Crawford County hasn't had a grocery store in 12 years. There's no grocery store in Crawford County and has not been one for over 12 years. So if you come to see me as a physician and I say, hey, we need to get you eating more fresh fruits and vegetables, where are you supposed to get them? You're either coming, the closest grocery stores, you're coming into Macon to Walmart down at Harrison Road, you're coming up to Aldi's, or you're going into Fort Valley. Either way you're going at least 12 miles to get to a grocery store. That's huge in terms of your health and how you manage your health, particularly if you have diabetes. So that's really huge. Is it easy to bring a grocery store into Crawford County? If the other thing that you would know is many people that live in Crawford County, they have one of the longest commute times to go to work. So if you're coming from Crawford County, let's say here, to work, when you leave work, if you're going to go by the grocery store, you're going to do it before you go back home, which means it makes it even harder to attract a grocery store there because your tax base isn't going to be as high based on that. We're getting your SPLOST dollars, not Crawford County.
I am a white male, age 56, assistant professor here at Middle Georgia State University. My income is $75,000. I'm married with 2 children. I live in North Bibb County. My health conditions are overweight. My BMI is 26, and I do go to an annual physical with my doctor.
Someone said they live in North Macon. Does that make a difference? Why? Yep, the income, if you mapped income across our county, you tend to have higher incomes on the northern end of the county, as opposed to the inner city part of the county, and certainly the southern part of the county. But in the southern part of the county, you also tend to have more folks that are retired. So their income is somewhat fixed. So based on this, you have these males that are up here. If you had to say who was coming off of this stage, wrong page, first, is it the white male that's 56, assistant professor at Middle Georgia State? My white male that's 32, makes $60,000 a year. Who was that? All right. African American male that's 73, retired principal. African American male, 32, works for Public Works, it makes 40. Who would get voted off the island first? Hey, she just waved by. She didn't call his name, just said bye. Who'd you take off first? The 32-year-old? Income? The stress of work? Think about what Public Works does. When your water goes out at your house and 13 MAZ said it's a water main break, you just want your water fixed. You're not thinking about the young man, the young lady that's down there in a hole trying to fix that. That just happened on Zebulon Road, a couple months ago? And folks were without water for a day or two. I hate when that happens because then we have to shut down restaurants and no restaurant can open until we say you can open back up after there's a boil water advisory. So I hate those because folks want to eat. Y'all can tell I like to eat too. All right. Who's the next one? So if he's off, just stay there. He's just going to turn sideways for a second. African American male to 73, or male that's 32, or male that's 56. A little louder. Yeah, they might be on borrowed time. All right, so that leaves these 2 males. 56-year-old assistant professor at Middle Georgia State, 32-year-old that's working at Robins Air Force Base. Difference in salary is $15,000. But the 32-year-old lives in Crawford County. This one lives in North Bibb County. All right, in terms of life expectancy, nope. Mm-hmm. Yep. Now, and I just said overweight. I didn't put any extra stuff on it. I didn't say where that weight was. Like, is it in the hips? Is it in the chest? Where is it? Is it seasonal? Anything like that? Yes, a pack a day. Pack a day. So that is a huge risk factor. And work on the base, that can be stressful. So when you look at these, even though we're doing this kind of as a game, talking about Survivor, what we're really talking about are what are those things in our communities that affect our health? Insurance status, demographics, what community you live in, what resources you have, what do you have access to, what do you have access to that you also don't utilize? So these are the things, and then, so I want you to put it in a personal perspective. When you go into your healthcare provider's office, don't think of yourself as the patient. Now I want you to pretend that you're the healthcare provider. So the same comments and things and thoughts that you had, whether evidence-based or not, now imagine you're coming to see me in the office and I'm that provider, and I'm looking at you and like, oh, you live in Pleasant Hill? No, you ain't gonna be with me long. Nope, their life expectancy is 63, so I don't really need to do all this other stuff. Versus on the same street as Pleasant Hill, if you keep going out toward Wesleyan College, you're gonna pass the Idle Hour community where the golf course is. Whereas the average life expectancy in Pleasant Hill is 63, the average life expectancy in Idle Hour is 82. 19 years of difference in 3 miles. That's not because of choice, that's because of money. Now, did that mean you take the money away from the folks in Idle Hour? Absolutely not. However, that money makes a difference, and unfortunately in this country, our health is inextricably linked to our wealth. It should not be, but it is. That is why we every day work to achieve health equity, that highest level of health for all. Does that begin to make sense in terms of things that you have access to, what you utilize, how those things are divvied up, day to day? I'm gonna switch real quick, and we'll do it a lot faster because I know I'm gonna run out of time. So thank y'all for being great male participants. Now I'm gonna switch, and we're gonna make them all female. Yours. All right. So this time I'm going to start on this end and just read the whole thing.
Hi, I'm a white. Sorry.
Oh, I'm sorry.
Hi, I'm a white female, age 17. I'm a student in Bibb County Public Schools. I'm a sophomore. I have 0 income. I am single with 1 child, age 2. I live in Pendleton Homes in Bibb County with mother and 2 younger siblings. My health conditions are unknown, and I am uninsured. I was removed from Medicaid.
I am an African American female, age 18. I am a student at Mount DeSales Academy and a senior. I make $500 a month at McDonald's. I work part-time. I am single with no children. I live with both parents in Warner Robins, Georgia. I have asthma, and I have health insurance through my parents. I go to annual doctor visits, and I just had a physical for college.
I'm an African American female, age 63, a retired executive from Geico. My income is $95,000 a year. I'm divorced with no children, but I have 6 nieces and nephews. Health conditions include high blood pressure, overweight, and a heart murmur. I live in Forsyth, Georgia, that's Monroe County, and do annual doctor visits with an OBGYN.
I'm a 64-year-old white female. I'm a retired real estate agent. My annual income is $160,000 a year. Married with 1 adult child. That child is 40. My health conditions are high blood pressure, pre-diabetic, and overweight. I live in Idle Hour community here in Bibb County. I'm self-insured, and I do annual doctor visits.
Okay. Let's start back on this end. 64-year-old, retired, real estate agent, decent income, lives in Idle Hour community, has a physician that they see annually. What are some of the things, preventive-wise, that this person should engage in? They got to answer these. Which test should this person have? 64-year-old, Caucasian female, retired. Are there some things that she should have done every year, every couple of years? Mammogram. Colonoscopy. What else? Pre-diabetic. So blood work, lab work that should be looked at. And that lab work should not only include glucose, but it also should include cholesterol. As long as they're having, I wouldn't get into the specific vitamins as long as they had a well-rounded diet, which we're just going to assume that she does. Any other preventive health screenings? What's the one we always take kids in for, but adults think once we get past 18, we don't need anymore? Before age 2, kids get 11 of them. Vaccines. I'm going to just throw a shameless plug in that this is flu season, y'all. Please go get your flu shot if you need it, pneumonia shot if it's time for it, RSV if you're over 65, and shingles, particularly if you're over 60 with a chronic medical condition or over 65. But vaccinations. Anybody ever had chickenpox as a child? Anybody ever had shingles? Do you wish that on anybody? So let's add the varicella vaccine in there as well. So, but vaccinations are huge for adults. Now, we're just coming out of COVID, and I'll say coming out of it doesn't mean it's gone. I think COVID's going to be one of those things that's going to be with us long term. And there was a lot of changing information during that whole height of the pandemic. So one, do your own research from credible sources. Y'all are on a college campus, so I'm sure every professor on here is going to tell you what a credible source is. I will say this, because my students know day one, if you reference Wikipedia, you will not pass. Because Wikipedia can change daily. Anybody can contribute to that. So that's why it changes daily, and everybody's information isn't correct. So do your own research, but the mammogram, the lab work, the vaccinations, the colonoscopy. The other thing, if you're outside, maybe seeing a dermatologist to make sure that those moles and things aren't changing, that those freckles haven't gotten any bigger, those types of things. We mentioned pre-diabetes, that particularly the periphery, your fingertips, your toes, your feet are getting checked at every visit. If you notice, I put my hand by the stove, but it wasn't as hot today. No, it was hot, you're just not feeling it. That might be a change in your glucose level and your diabetes. The other one, our 17-year-old white female, sophomore, one child, age 2, lives in Pendleton Homes, has 2 younger siblings, uninsured. What are the risk factors? I'll tell you about a few. 17 years old with a 2-year-old. So when did she have that child? At 15. We do know in this county over the last 20 years, our teen pregnancy numbers have dropped almost 80%. That is wonderful, almost 80%. And it's because not of things that public health did in isolation, but because of all of the community-based activities that were going on. Some things public health did, doctors talking to their patients, mothers talking to their daughters, grandmothers talking to the daughters, churches talking to somebody, community-based organizations, all of that in its entirety has caused our numbers to drop 80%. We used to average, when I first got back here in 2001, we had about 450 teen births a year just for Bibb County. Now we're less than 200. We're about 165, 175 last time I looked. But we also know that if a young lady delivers a baby before the age of 18, 1 in 5 will redeliver within 24 months. I specifically put in there she was 17, but a sophomore. How old were you when you were a 10th grader? You weren't 17. You were probably 14, 15, which would tell me this young lady's probably been retained, if not once, but twice. At what age will the school system is required by the state to look for you if you're not in school? 16. Once you turn 16, truancy officers don't have to go looking for you. Our current superintendent, Dr. Daniel Sims, has had several meetings. He's put it out on Facebook asking for community help. We've been in school now 7 weeks. They've got about 20% of the school system that has missed more than 10 days. You've only been in school 35. How you been out for 10? So school attendance is a public health issue. We need them in school because who remembers that? Who has a teacher that they remember, hopefully for a good reason, has a teacher that they remember that made a difference in their life? On that day that happened, or that one thing that you can remember, now think about if you had not been in school on that day. you would have missed that opportunity. You would have missed that word. You would have missed that pat on the shoulder to say, you know what, I know you're working and I see you and you're valuable. Too many of our kids are not in school 8 hours a day and miss that opportunity. That's why we have to keep, in this case, that young lady in school, because it's now going to impact things down the road. She has a higher risk of having additional children. She's in the home with the mom and 2 other younger siblings. She's the oldest. They see what she did, and we're like, oh, that can be my path too. There's some things that are, some people say generational curses. They're generational challenges. But there can also be generational opportunities. And so when some things need to stop, it doesn't mean that the world ends, it means something else starts. And for many of us, her health doesn't need to stop at 15 because she had a child. Because you don't know what that child's going to be. That child could grow up to be that retired Middle Georgia State assistant professor. You don't know what's going to happen to that child. But if we don't nurture that environment, then we also know that that child can't flourish. So we have to do that as well. Yours was 18. So did a difference. One's in public school, one's in private. One's in Mount DeSales? Yeah. Mount DeSales, senior, works a part-time gig, no kids, lives with both parents, asthma, just did their physical for college. Are their trajectories looking different? Yep. Now, I grew up in public school. My mom taught public school for 42 years, special education. My dad retired as an assistant superintendent. The day he retired, I said, what'd you do today? He said, I did the thing all my teachers do when they retire. I said, what's that? I didn't go to work. He said he wasn't going to another PTA meeting, school board meeting. Matter of fact, he said he wasn't going back to Sunday school because it had school in the name. He was done. He was tired at that point. He's like, I've done my part. But whether it's public school or private school, our kids have the ability to succeed. But we also need their health to be on point to get them there. I can't tell you how many calls I get. I got one about 3 weeks ago. Young lady called from Macon. She was at Virginia Union University, and the only thing she was missing was her vaccination record. And they were like, if you don't turn this in, we have to dismiss you from school. It took us 5 minutes to find her shot record and get it to her. But what if we hadn't picked up the phone? What if we hadn't been available to her? So in thinking about that, make sure that you're also available, because your health of your students, not only it expands beyond the academic, it also goes into the other things that they need. So it's those little things, because that could have been that one stressor. Can you imagine somebody coming home because they couldn't get a vaccination record from the health department? That doesn't make sense. All it took was 2 quick phone calls. I need this record, I needed to go to this place, and let's verify that it got there. And that young lady was fine. We can help our folks in their health journey. And the last one, what was yours? Right. Divorce, no children, 6 nieces and nephews, high blood pressure, overweight, heart murmur, lives in Forsyth, annual visits with the doc. Those same health screenings apply? Mammogram, colonoscopy, vaccinations. Those are ones that we have to have somebody prescribe. Are there certain things that this young lady, all of them, could do at home? What about a self-breast exam? Once a month. One of the things I can tell you through public health practice, if you run across someone who's over the age of 40 and does not have insurance, we have what we call the breast and cervical cancer screening program. They can come to the health department, not just ours, but any health department in the state of Georgia, 159 locations. The nurse will do the clinical breast exam. They will then sign you up for this program. They're going to schedule your mammogram, and we're paying for it. Because mammograms are running about $1,000 a piece. That's a deterrent for people coming and say, I don't have $1,000. I know I need it. I'm going to put it on the list with everything else that I know I need and haven't gotten to yet. Anybody know what LIST, that acronym, stands for? Most times we use it as a word. I use it as an acronym. LIST. In many cases, look at your list and figure out if it means left out, ignored, set aside, turned away. Now I want you to go back and think about what's on your list. And if those things on your list are things that are positive for your self-preservation, we need to get them off the list. Those don't need to be left out. Those don't need to be ignored. Those don't need to be set aside. We really need you to do those. And to be an encourager for someone else that may be going through the same thing. Sometimes a person won't go just because, oh, I didn't have a way to get there. My car is full of gas. Can I drop you off? Can I go with you? Because I'm just going to be sitting at home doing something else. But if I can go sit with my friend while they're in that doctor's visit, sometimes I'm not going to ask you what happened in the back, but sometimes just going with somebody else and knowing somebody else is out there that's waiting on me, that cared enough to come with me, makes a huge difference in how we move forward. One thing I'll try to end on, because a lot of this we talked about males, and I won't necessarily ask you who would you vote off of this, because of how y'all did the first one. I kind of know who's going to get voted off of this one first. But for males, what are some of the preventive screenings that they need to have? Prostate. And, because I'm going to put that plug in there for this one, next Saturday, during the Macon Beer Festival, which is a health fair disguised as a beer festival. It really is. That's the tagline. Did I get that right? It is a health fair disguised as a beer festival. But if you on, Poplar Street, I want to say between 2nd and 3rd, there will be a space where prostate cancer screenings are going on. It's been going on in the community for years. The health department gets to be a part of that, along with the hospital and a lot of other volunteers. And we set the record for how many men have been tested in 4 hours. 150 men through a blood test. We're not out there doing digital rectal exams in the middle of the street. Let me say that again, because there was some folk looking at me like, y'all do this on Poplar Street? Through a blood test, but it's about $600 to $700 worth of blood tests provided for free through a partnership with the Prostate Council Education Center out in Colorado. These men come, they fill out a registration form, they then go down and see the phlebotomist from Atrium. They bring those tubes back to the registration table, and in about 3 weeks, they're going to have their results mailed to their home. If you have that hard-headed male, of which I got a whole family full of, I probably lead the bunch, that their PSA is 1.5 or higher, they have a navigator that is going to call you on the phone and say, hey, did you take them results to your doctor? You're going to get a letter with all of the results asking you, please take these to your physician. And then they're going to follow up for anyone that's over 1.5. This center is out in Colorado, but it's Macon, Georgia that tests more people than anybody in the country. And we do it once a year, so it's next Saturday, October 19th, downtown Macon. They'll be set up between 2 and 6. But if you think about 150 folks being tested in 4 hours, that's a lot. And we're actually trying to push it to 170, 175 this year, because the folks in Colorado think they're coming for us, and we're not going to let that happen. We're going to get more. So please tell your folks, if you've got a husband, significant other, grandfather, uncle, like, hey, I want to take you to the beer festival. Well, all right. I think they're going to come to my side. And then as you get them that beer, you keep walking right on down the hall, right on down the walkway, and get that blood drawn. It won't cost you one thing, but it could save a life. So we really need you to come. Prostate is one. Lab work is the other one. So that general lab work that you talked about for women, males as well. The other thing is talk to your males not only about what their prostate level is, but what their prostate is doing. So, you send your 2-year-old into the bathroom, they back out in 15 seconds. You send a 20-year-old in there, Oh, I don't need to go to the bathroom. I can go from here. And they probably can shoot you a stream and hit the wall over there. Right about now, if you got granddad, he backing his feet up because he trying, he don't want to get his feet wet. It changes over time. All our bodies change over time. So please talk to them. Are you staying in the bathroom a little longer? That might be a sign that they're not talking about. High blood pressure, diabetes, arthritis, vision, all of those screenings, going to the dentist. All those are huge, all those are important. Any questions for me? Because I think I'm about to run out of time. Any from up here? Y'all good?
Good.
Y'all ready to get off the stage? We thank our voluntold participants up here. Thank y'all. But I will say this in closing. One, you do have public health practice in every county of the state. One of the other roles that I hold, I'm actually currently the president for the Georgia Public Health Association. So 159 counties, 120 of our counties are designated as rural. Populations less than 50,000. But we're the only consistent healthcare provider in every county in the state because we have counties with no physicians, we have counties with no nurses, we have counties with no hospitals, we have counties with no mental health providers, we have counties with no dentists. So there are things that we have in our health department because we're a little larger. So if you didn't know, we have a dentist in our health department. Our dentist is there 2 days a week. We have a dental hygienist 5 days a week. We primarily take care of children, but we will see adults on emergencies. Now, we're not doing braces. We can't do that. But we can, for our adults, if it's an emergency, pull the tooth if it's an emergency. But we can see kids at the dentist's office as young as 18 months old. Because when I'm going in the Head Start program, and we do that at the beginning of every year, and I see 3- and 4-year-olds, and all of their molars have already been capped off because they've decayed. We'd like to get to those kids earlier. I mentioned that breast and cervical cancer screening program. We have that. We have a WIC program, Women, Infant, and Children. Last time I was out here, a guy asked me, he said, what about the MIC program? Men, Infant, and Children. Men qualify for WIC too, if you're the sole provider for the children. If you're the guardian, the sole provider for the children, you qualify for WIC also. Kids can stay on WIC until age 5. So unless your income changes, why do we have folk pulling them off at 1 and 2? Because you still have like 3 years of eligibility. In our building, last month we provided 3,800 services for WIC. And my team looks at me side-eye when I come down the hall because I think that number should be 6,000. With the incomes and level of poverty we have in our community, that number should be so much higher. We've got to get folks to come in. We know that medications are expensive. If you know someone that can't afford their medications, if they come to us, we have a 1-pager they can fill out. They can put their medications and the cost on a sheet. We will look them up and tell them where's the cheapest place in this county to get your medications. We do that for no charge.
Right, everybody. Let's give Dr. Jimmy Smith a hand and thank him for coming out to do this for us again.
No problem.
He did this for us in August, and he's done it again for us here in October. We also want to thank Dr. Blake for allowing us to do this today. So thank you, thank you, thank you. All right, everybody, please take a look at the webpage and take a look at what we've got going on for the rest of this week and next week. And please, please attend these activities. We also have Walking with the President here on the Macon campus tomorrow at 8:30 a.m., and we will start at the bridge. So please, please join us. All right, you got it? 30 minutes. All right, everybody. Thanks. Be healthy. Have a great day.